Functional flexibility. Again, with Nick, our pre-exercise stretching was more along the lines of doing a light set on the elliptical, but again, maintain active flexibility. So he's getting forward and reverse movement on his legs, more important for hamstrings and quads, but he's doing something, okay? So on the pre-exercise, okay, myofascial release, warm up or static stretches. Myofascial release, remember, is usually somebody manipulating themselves with usually a foam roller or some appliance, a ball, foam roller, can of soup, ball, etc. Okay, myofascial release, this AIS means active isolated stretching and dynamic stretches, or dynamic stretches and ballistic stretches. Okay, gang, hear me out and look at me, eyes up here. Don't do ballistic stretches with somebody that you don't know if they can handle it, okay? Somebody did ballistic stretches with Nick. Well, one, you'd say, to hell with you, I'm not doing it. But remember, sometimes if you're training somebody and their relationship outside the gym's a little odd, they may say things to you to please you. That makes sense? So look at their body language and not necessarily their words. Ballistic stretching, approach with caution. Okay, so during exercise, if you have a deconditioned athlete, active isolated stretching. Conditioned clients and athletes, dynamic movement stretches. Post-exercise, again, myofascial release. Anybody, when you see PNF, that means proprioceptive neuromuscular facilitation. That means helping somebody hold a stretch or static stretches, okay? Again, a short word on proprioceptive neuromuscular facilitation. It can be well tolerated with some subjects and not well tolerated with others. I've had very, very good results, though, with proprioceptive neuromuscular facilitation with knee replacement clients, okay? A knee replacement, usually their extension is good and their flexion is poor. Just the nature of the appliance. Nathan, have you noticed otherwise? Okay? So, with a knee replacement patient, okay, that's in my scope of practice, I will do PNF stretching with them to try to enhance their leg flexion. Leg extension, now notice, and gang, hear me out. If I'm standing here, my legs are directly below my pelvis and my feet are directly below my pelvis. Okay, I'm extended almost fully, right? We all get that? Now, on the corollary though, if we're laying prone, trying to do what, a leg curl, which is our leg bicep flexion, that's usually where a knee replacement patient has some problems.
Is it because the closing of the angle from the scar tissue, like the scar tissue is preventing the angle from closing?
Nathan, I don't know that because I haven't talked to their doctors directly about that, but I've been given the okay to work with them on PNF, but that is the case. Everybody hear what Nathan said? What would inhibit flexion at the knee? And probably the scar tissue. Again, that's a pretty barbaric surgery to watch it.
Oh, yeah.
It really is. But usually people respond really well if they get up and move. Usually part of that surgery is a rehab. If it's not, and I've seen it go south too, double knee replacement on somebody that was deconditioned, guess what? They died in a wheelchair. Happened to somebody I know. Tried to talk her out of it. That's crazy. Do one at a time. Do whatever one hurts the most. No. Immediate gratification in our society. Yeah, now she's in a box. Okay?
She couldn't move at all when she got them both done?
No. Pain tolerance was too great. Then became sessile, meaning like a sponge, not even moving. locked it right up. Then depression sets in, all the rest of it, death ensues. Yeah, Anna, you look a little confused, don't be. This is a statistic a doctor told me. He didn't throw any hard numbers at me, but he's an orthopedic surgeon. If an elderly person breaks a hip, his observations were if he didn't get them upright, of course with help, within 12 hours, their chances of dying within 2 days is 80%.
Christmas.
Something happens to the body, and it has a shutdown
Breaks
effect.
where?
Just
A
a,
hip fracture,
an old person break.
old person breaking a hip, falling and breaking a hip.
Like that bone, breaking it?
Right here, here's a hip fracture. This breaking off at the femur.
That
Okay.
can break.
Absolutely. Nathan, isn't that part of your daily routine?
That's the weakest part of your femur.
Yep.
How do
Top.
you know it's
That's
weak or
called a
not?
hip fracture on it, and it's deadly. It can be deadly for old people.
How do you know when? Well,
Pain, shorten the rotation of the extremity.
can you tell when it's weak? Like, would you?
Oh, if it's weak? Oh, if the bone itself is?
Yeah.
No, a layman couldn't. A doctor could through a bone scan and x-rays and so forth.
It just happens from osteoporosis and falling on it
Oh, yeah, yeah.
And congenital, like disease of the
So
bone.
bone
We
density
had a
matters.
old lady, all she did was, she fell from the stand position and she busted her femur because of a bone disease.
Yeah, yeah. Oh, yeah, on it. Deadly.
So I know you're not a doctor, right? But
I play it on TV.
when I
Dr. House.
hurt my back,
Yeah.
my hips were like this.
Mm-hmm.
I was like this, but my feet, like at the bottom, was planted normal. You know, it was just very weird because if you'd see me like that, I'd be right, like as if I was just standing. But my whole body was like this, and there was no way I could. I mean, it hurt to even just like stand or walk or whatever. But ever since, like, I have pain right here,
Okay.
and I go to the chiropractor like every 2 weeks, and if I stop going for some reason, the pain
Yeah.
comes back.
What was the
Is
nature
that-
of the injury again?
I wasn't wearing my heel lift,
Uh-huh.
and I just carried my son
Okay.
and put him on. I took him out of the bathtub and put him by just like on the floor, and I felt like, oh gosh, it's hurting. So I went and laid down, and I just couldn't get up. It was
Just
just.
slipped your disc.
I thought I wasn't gonna dance ever
Yeah. Hold
because
on.
my hips were like this.
I said, again, Nathan has seen a lot of that. All I would do is if you came to me complaining of these things, okay, let's do a scenario on it. You came complaining of these things to me and you wanted to train, I would get a note from the doctor. Are any movements contraindicated? If no, the first thing I would do is do some static stretching on you from a hanging position, just to try to decompress that spine. First, that was the first thing I would do. If the doctor said no, there are no contraindications, okay? And from there, we'd spend 10-15 minutes just static stretching. From there, then we'd walk over 2 feet and do back extension, but not active back extension. I would just have you rest in the down position. Get that erector spinae in a static stretch. Then we'd do some light abdominal work. And so then,
So you're basically looking to strengthen everything in that area to try to help
okay, we
support.
decompress the spine. This is warm up and this is warm up, and then I'd see it, and then I'd progress from there.
You start working towards any of those outer hip areas and whatnot as well, or?
Not initially.
So
I would then do some rectus abdominis exercises and erector spinae exercises, very low intensity.
Okay. Just both of those?
So do you
To
think,
start out with, no, I would do the whole range of motion eventually, but just to start.
Yeah.
So the pain that like I have here, it's not the bone, right? It's like
No.
the muscle.
No, that's
It's
gonna be
probably-
derived from a tissue or a muscle.
Or, or even a nerve.
Yeah.
Could be your sciatic, you got,
Mhm.
they're huge, I mean, they look like a shoelace, that's how thick they are.
Shoots right through that hole.
They're,
Mhm.
yeah, they're called dermatomes.
Okay.
When you displace or rock your spinal column back and forth, it pinches those nerves, and then
Okay.
that, your brain perceives that as pain.
Yeah.
Yeah, I always, a lot of times I stop training because of the pain.
Yeah, but like I said, going back, first thing I said, I would find out if there were movements that were contraindicated that you couldn't do. If not,
He's told me no.
I'd follow my instincts and try to decompress the spine. Again, spinal neutrality, get the spine straight, and work from there.
Can we ask
Strengthen
for an
your
X-ray and an analysis and see what we have as far as potential disc issues and whatnot? to
No,
work around?
it's not in our scope of practice to evaluate x-rays.
But can we suggest that and then have a response given back to us as far as ask your doctor if there's any disc
Oh,
issues or
absolutely.
disc displacement that we could?
Your doctor would, when I threw my back out, I went to, it was on duty, so I went to our occupational
Workman's
doctor.
comp doctor.
Mm-hmm.
And he looked me over and he said, and you also have little hooks in your spinal column too.
Mhm.
Well, he said that was shifted forward a little bit, hence putting pressure on my nerve. So he prescribed 3 visits to the chiropractor. So you go to the chiropractor and the chiropractor says, well, I know it's not this and this and this, but if you want to take an x-ray, we can do an x-ray, but in my opinion, you don't need an x-ray. I'm like, I don't need it, I don't think you need it, because they want an x-ray you just to see if there's any fractures that could, like because when he contorts you and manipulates you, if there's a fracture, it could,
Make it
go
worse,
into the
yeah.
spine.
Yeah.
So then he manipulates you and then corrects the spine, which is probably what your chiropractor did, and you have more mobility out of it.
And I would, just from my back experience, I would expect when you alleviate that pain, if the pressure's taken off, but then when you don't do it, things start going back to where they're not supposed to and starts pinching those nerves, which is why that pain starts coming back.
Yeah, well, sometimes I know, like,
Because I was doing chiropractor 3 times a week.
sometimes I try to put more weight than I should, and that's one of the things he told me. He said I shouldn't be trying to lift as much weight as I
Mm.
tried. So he said to just the weight, to not go.
Yeah. But again, like I said, not knowing anything, and from what you've told me, yeah, err on the side of caution. Get a doctor's okay,
Right.
and if anything is restricted or contraindicated. But if not, from what you've told me, I would see you benefiting greatly with some spinal decompression, which is clearly in your scope of practice. It's a good place to start.
How do you feel about chiropractic care, just on a personal level? We can
They
shut it
scare
off
me.
if you have to.
Don't record me
Yep.
on that.
Whack
Well,
crap.
I've had a lot of these